This is Micah Glover. He's a Master's of Athletic Training student. He's going to present his research on concussions and helmets within football athletes. So, without any more, I'm going to let you turn it over to Micah and let him go ahead.
My name is Micah Glover. I'm in the Master's in Athletic Training here at JSU. So I've decided to do my PowerPoint on how to lessen the severity of concussions in football athletes with how big of a problem it's been in the NFL here recently. So to start, what is a concussion? A sports-related concussion is a traumatic brain injury, and it's defined as a complex pathophysiological process that affects the brain. It's usually induced by outer biomechanical forces. Management methods that we use were helmets, education, and proper tackling techniques. So for my focused clinical question, I used a PICO question. My participants were football athletes. My interventions were helmets. I compared them to education and proper tackling techniques. And my outcomes were mostly that both options are effective, but in different ways. The databases that I used with my search were PubMed and the JSU library. I used a combination of keywords, mostly involving football, concussions, and preventions. So for my inclusion criteria, the studies had to be published in English language. The studies had to be performed within the past 10 years. I would have liked to have done a smaller range for that, but not a lot of studies have been done on this. And studies that were focused on concussion severity control and not just prevention. So my exclusion criteria, I got a lot of soccer and rugby when typing in football. And then studies that were focused on rehabilitation of concussions and not helping prevent or lessen the severity in the first place. For my quality of evidence assessment, I used the Pedro scale and the stroke checklist. The results of my articles, I selected 4 articles. One discusses the proper tackling techniques. One shows the difference between 2 different Rydell helmets. One discusses the different lining that's inside the helmets, and one discusses the implementation of the targeting call here in college football. These were the scoring of those articles. Most of them had pretty good outcomes, and if they didn't, they usually got excluded. So, first article that I want to talk about is at-risk tackling techniques in American football. This shows, my chart here shows that the different ones I'm going to talk about. Head-to-head contact is the most at-risk form of tackling among football athletes. Head across the bow and head down tackling are what they're usually called when at practice and when at different sporting events. And then shoulder tackling was known as the safest form of tackling, and that's C, the bottom one. 75 to 83% of coaches in high school and college football teach the head across the bow technique, which is B on that, and then A is the head down technique. But a large percentage did teach B, which is extremely dangerous to athletes. It puts a large stress on the brachial plexus and some of the neurological stuff going on in there in the cervical spine. And then A obviously puts a lot of stress on the cervical spine and the brain. The next article I picked was about 2 different Rydell helmets that they studied, and it was about can they reduce the risk of concussions in football. The VSR4 and the Revolution were the 2 helmets that they studied. The Revolution is the bottom helmet, the VSR4 is the top. Or my bad, swap. VSR4 is on the bottom, Revolution is on the top. The VSR4s had a 4.47% concussion rate, and the Revolutions had a 2.82% concussion rate, and this was done over a 5-year span at 10 different schools, I believe, at the college setting. And one thing to note is the Revolutions had a lower impact, or had a lower rate of concussions, but had more impacts throughout the season. More athletes were using them, and they still had a lower concussion rate. The next article is about inadequate helmet fit and the different lining within helmets. A minimum of 7% of concussions happen when there is an improper fit of the helmet. That could be a number of things, whether it just hasn't been inflated or it wasn't properly fitted in the first place. Helmets should be checked periodically throughout the season because a lot of things can change. The air bladder within helmets can deflate. The athlete can do something minor like cut their hair and it already changes everything, that the fitting and everything. And the lining within helmets does change the symptoms that an athlete can have once they sustain a concussion. And that is the air bladder, which is shown on the top, has a longer duration of concussions once they've sustained one, and a higher sensitivity to light. And then the gel and foam lining have a higher rate of loss of consciousness once they can sustain the concussion, and they have increased drowsiness throughout their symptoms. The next one was risk of concussions after a targeting foul in college football. Athletes are 37 times more likely to sustain a concussion when a play happens that would normally be called targeting. It shows that there was a 40% decrease in concussions in collegiate football once they implemented the targeting rule. And both players involved in a targeting call need to be evaluated regardless of if the call is overturned. Both players need to be pulled off and evaluated because they still sustained a hit that is 37 times more likely. Clinical bottom line is certain helmets can be beneficial in reducing the risk of concussions. As shown, Revolution was already superior to the VSR4, and that's just within Rydell helmets. Lining of helmets affects the different symptoms that concussions have. That's something I never thought would be a key factor. And then tackling through the shoulders is the safest way to tackle in American football without sustaining a concussion. And then helmet fit does matter. My implementations are helmet design can be beneficial. Air bladder and gel and foam lining differ in symptoms. Tackling through the shoulders lowers risk of concussions, and targeting call greatly reduces the risk of concussions. So some of the future research I would like to see done that I couldn't find. There's the only study that I could find comparing two different helmets with this was the one that I used. No other helmets were mentioned, no specific helmets were mentioned. I would like more studies to be done on different types of helmets because obviously Rydell's not the only one that makes them, and they don't have just two helmet designs. There's a new helmet that a lot of NFL athletes who are sustaining concussions at a high rate are using. I believe it's called the VG helmet. And they're also pairing it with the Q collars that I mentioned there. They're wearing a Q collar, it wraps around the neck, and it puts pressure on part of the brachial plexus and the muscles there. I would like to see more research done on that as to how it's actually beneficial. And they're pairing it with the VG helmets. It's supposed to somehow lower the risk of concussions. It's just something that started happening this year, I believe. I'd like to see more research done on that. I'd also like to see more implementation, like how the new safety rules, like protecting the quarterback and stuff like that's helping with concussion rates still today. And then I'd also like to see the different concussion rates studied on the different linings. A lot of it was focused around the different symptoms that you see once they sustain the concussion, but how effective are the two different types of linings compared to each other? These are my references. Thank you, Dr. Clark, Dr. Savage, and thank you to my cohort for helping me through all this. And then thank you all, JSU Student Symposium, for accepting me. Questions?
Could you explain a little more about what exactly the targeting foul is and why it's so much more dangerous than the other?
So the targeting call is famously head-to-head contact. It's either head-to-head contact or when an athlete leads with the crown of their helmet, which is the top. So it's basically just an increased risk of head-to-head contact, which is shown to be the most at-risk form of tackling.
Other questions for our speaker? All right, let's thank him again.